covering the equity issue, and then seriously looking at our excess earnings potential over the next year. And when we get close to June 30th of 2009, if it looks like we don't have excess earnings, we currently have enough reserve to pay for 2 years health insurance, the full cost of that. We have around $10 million. The annual cost, if we didn't have any contributions from the employees, about $5 million. We have 2 years. We need to be looking at that third year. And so next year, at the end of 2009, and before that, we'll start looking at it during the year. If it appears there's not going to be excess earnings to cover that third year, then we will be back trying to figure out what we're going to do that third year. And that was the recommendation that came from the retirement board, that we get the benefit of the equity issue, and then we look long range at how we're going to generate the third year's excess earnings.
It seems that maybe, though, there's a disconnect, because I agree with Ms. Clower's numbers that the $85 per month premium increase for all retirees is going to do a cost increase of over $800,000 to the plan. So somewhere along the line, in terms of charging only the under Medicare age retirees a contribution, if you will, of approximately $100 a month, I think there's still somewhere there's a disconnect. I'm not sure that we really do arrive at that $138,000 benefit to the plan out of that scenario, but I don't know quite where the disconnect is. But it seems that somehow it's tending to come up short. I don't quite see where that is, but.
Well, I've always looked at it as how many years can we cover, and that's,
right.
That's the issue with me. How long do we have before we're really going to be in trouble? And we do have, even if we didn't collect the $100 a month from the retirees, the annual cost is projected to be $5 million. And then that's reduced by, that includes the amount that the retirees pay for their dependent coverage. When you reduce the $5 million by the amount that the retirees pay for their dependent coverage, it's down a little bit more. So we're really spending under maybe around $4.5 million a year. We have 2 years worth of coverage, and that's what I've been looking at is not how much this will save compared, because costs are going up and we're going to generate this much money. How long do we have before we really have to look at this?
So the cost, you're saying the total cost of the plan, taking out the dependent coverage, which is totally paid for by those dependents, is a $4.5 million, somewhere in there, in that ballpark?
$4.65 million. Right.
So do you, but why don't you talk a little bit about, because you and Sue Thornhill have the best information on this, about the shortfalls of the plan this actual fiscal year. Just closed in July for the first time in, I don't know, a long time or ever, I don't know when, the plan was short.
Sure. We established we reserve an amount of money every month to pay for retirees' health insurance, and it's just a matter, it goes into another fund that eventually pays the cost. We are self-funded. We're billed twice a week on the cost of the retirees' health insurance, and we send money into Delta to cover that. We have been reserving $510 per month per retiree, and the retirees have been paying $510 a month for their dependent coverage for approximately 4 years, and has not changed in that period of time. The first couple of years, the $510 a month was considerably more than we needed. At the end of the year, we had underspent that reserve. I know the first year it was somewhere in the neighborhood of $400,000 or $500,000. The second year it was over $700,000. The third year it was somewhere in the neighborhood that we underspent again of about $300,000. And then this past year, June 30th, 2008, was the first time in the 4 years that we have been reserving $510 that we actually overspent the amount that we were reserving, and that was around $400,000, somewhere in that area. So the 510 was a good number for many, many years. Actually, it was an additional amount for a number of years, but we also realized in seeing the GASB 45 actuarial report that was presented that the trend for the following year is going to be a 15 or 16% increase in health costs. And since we overspent the amount we reserved last year, we realized we have to increase that $510 a month, because not only because costs were higher last year than we thought, but the trend is going to be there 15 or so % higher this coming year, right, and probably the same year after that.
Hence so the 510 goes to 595.
Goes to 595
January
or
1st.
If the trend isn't realized at a full 16%, then it may not go all the way to 595 the first year, but it'll be somewhere in that area.
So would it be your position that we ought to just continue passing those costs on to the system and that none of that should be borne by the retirees themselves? Do you think that the system can continue to afford all of the necessary increases into the future?
If we have excess earnings. If we have excess earnings, again, we wouldn't be here talking about this today, other than the equity issue again. As long as we generate excess earnings, that's basically what they're there for. And the retirement system has never spent those excess earnings on anything but health insurance. And in good years, we have been able to reserve far more than what we need for the following couple of years. We've never fully gotten to 3 years worth of coverage, which is our goal. The retirement board, when the county issued its 2002 pension obligation bonds, along with that, the retirement board adopted an excess earnings policy, and that policy was to try to generate 3 years worth of health insurance coverage. And then there were two other things that we would do with excess earnings after that, of increasing our contingency reserve and then helping the county after that. If we got to that point where we increased our contingency reserve like we wanted to, we were going to help the county pay down the unfunded liability with our excess earnings. The goal being to have 3 years of excess earnings at all times.
So wouldn't it be prudent to start taking those steps now instead of this wait and see approach? That wouldn't it be prudent to like step forward in a small way now to say, hey, we want to fulfill that promise of having the 3 years in